Oluwarotimi Adeogun is just right here in the studio. Sorry, I don't know where I got the Oluwarotimi
All
and
of the above.
Abejide.
It's all good. Good
All right.
morning.
Good morning to
Good
you.
morning.
And of course, today is the ninth day in the month of October 2025. And check your time, it's 10:35 already. We'll drive through, from now up until 12 on the DOT before we retire from here. But don't forget that around 11 a.m., we'll have a short break to have someone else in the studio before we continue with the conversation. Don't worry, just chill, okay? For some persons who sent their messages last week and I couldn't actually read, please, you can send the messages just right now, okay? Yeah. Couple of messages I couldn't even touch on. Plenty of them, please. If you remember, I told you, don't worry, I will take them today, right? Feel free to send the messages today. Use the WhatsApp number as usual, 081 717 56338. 081 717 56338. Okay? And we're also streaming right now. You can get to YouTube and watch us live. Get to the comment section and drop your comment. And you can also drop your question. Okay? Thank you so much. All right. Let's get talking, everyone. The rise of diabetes and high blood pressure in Nigeria, what you must know. This is going to be the part 2 of that, okay? Several questions I wanted to ask the doctor last week, but I couldn't because I wanted to just take your questions first, okay? But today, let me see if I can ask some of these questions. But then, before we continue, doctor is going to do a recap of how we started, what he said, the last time as regards diabetes. All right? So let's begin from there, doc.
Okay. Yeah. Good morning, everybody. Nice to be here again. So we'll just do a recap of what we started last week. We were talking on diabetes and hypertension. But to kickstart with diabetes, we would want to pick on the key points that diabetes is a chronic medical condition. It's a metabolic condition whereby the body's ability to break down and utilize glucose is impaired. So basically, when there is diabetes, you find out that there's a lot of sugar in the blood, in the circulation, but it's not getting to the cells where they're supposed to be utilized. And when this happens, you find out that the condition we refer to as diabetes results. This elevated blood sugar that is persistently high in the blood, presents with certain clinical manifestations in the individual. First and foremost, a person may notice that they are urinating more frequently than before in large volumes. They may also notice that they are getting thirstier by the day, requiring to drink more water frequently more than what is usual for them. They may also notice that their appetite has increased, and they may also notice that they are losing weight, unintentionally. They're just losing weight and they can't explain why. Some of them may also present with features of poor wound healing. If they have wounds, they may not heal. Those are possible complications of diabetes. Some people may have erectile dysfunction as men. Some people may have numbness and tingling sensations or pin and needle sensations, in their hands and in their feet. And a number of people may also realize that when they eat, sometimes it looks like the food stays longer in their tummy, and they are almost having it going back upwards because the way their stomach empties into the intestine is slowed down. So they have what we call delayed gastric emptying. That is also a complication of diabetes. And you also have where they start having blurry vision or change in their vision, and ultimately blindness in some people. So diabetes can also result in blindness, loss of vision in people. So before all these complications start, it must be that the diabetes has existed for quite, a significant period of time without them either realizing, or they realize but they are not taking the right steps,
Okay.
or they have not instituted the right treatment. So it's important that when you are diabetic, you go for treatments that have been tested and trusted. You go for treatments that work. You don't do trial and error with your health, because all these complications I listed, none of them is what anybody wants to experience. And it's also scary to know that diabetes can make people lose their limbs. Some people have their limbs amputated because it damages the blood vessels, and once it damages the blood vessels, some areas of the body can get gangrenous. When they have wounds that won't heal, and the necrosis and the cell death happens there, they lose that limb and they have to cut it off. So a lot of people have amputated limbs from uncontrolled diabetes. So diabetes is not a funny condition when you have it, and it is not a death sentence either. Meaning that if you have it, that doesn't mean you should give up on life. It means you should seek the right help and get the right treatment. And your treatment entails a combination of you using your right medications, being compliant with those medications, your dietary and lifestyle changes. You have to cut down on the carbs, and you have to follow a strict diabetic meal plan that's especially written to you either by your dietitian or by your doctor. And then you also have your regular exercises that would help you to improve on your insulin sensitivity, and then also for you to maintain a healthy weight. Your exercise is mandatory when you're dealing with diabetes. And of course, your regular health checks, because you need to keep monitoring your blood sugar, knowing how well you're doing, going for your A1C blood test that helps you to measure or assess your glucose control over a period of time. So when you come regularly to the clinic, your doctor requests for that test so that they are able to know how your glucose control has fared, over a period of time. All these are very, very necessary for you to be on top of your game with diabetes. And the good news is that a lot of people have successfully managed diabetes, and they are doing well with minimal complications. And the truth is that a lot of people that are compliant, they live normal lives just because they've adjusted to what they're supposed to do. But unfortunately, people who are looking for shortcuts, or people who are looking for the easy way out, or who are looking for alternatives in the wrong places, will end up with all the complications we mentioned earlier. And it's such a very painful place to be, because those complications are really, really horrible. So it's better that you please do the needful. And if you're a pregnant woman, you notice that you have what we call gestational diabetes, your diabetes developed in pregnancy, please go to see your professional, go to see your healthcare professional, because the drugs that you would need to control your sugar in pregnancy are completely different from what you would have used when you were not pregnant. Insulin is preferable in pregnancy, and it is not is a situation where you just want to treat yourself, because you may go wrong. And there are other complications that may come from a woman being diabetic in pregnancy, because her child may be bigger than usual. She may have a 4 kg or above that size kind of baby, and the baby may also have some complications or even some congenital anomalies, born with some structural defects and all that. So it's very important that when you have this kind of situation, you seek proper health care at the right places. I need to emphasize that, because in our health system, we still have a lot of ups and downs, and everything is still not what it's supposed to be. So that's why you have to take the responsibility of getting the right kind of help and timely intervention. And please, because this is your health, take responsibility for it. Take the needed steps, because that is your life depends on it, and the outcomes.
Now, you touched on the type 1 diabetes and type 2 diabetes. Please, can you go over it again?
Yes, we have the type 1 diabetes, we have the type 2 diabetes, and we have the gestational diabetes. The type 1 diabetes is the type of diabetes that is insulin dependent. Insulin is a hormone that is produced by the pancreas and helps to control blood sugar. So when you eat carbohydrate foods, your body breaks it down into sugar, and your blood sugar rises. But insulin is secreted to make sure that that spike in the sugar in the blood is moving the sugar into the cells where they're supposed to be used. But in type 1 diabetes, insulin is either deficient or not available at all. So in type 1 diabetes, you have insufficient insulin production or no insulin production at all. So it's a problem of insulin deficiency. So most of the time, for people with type 1 diabetes, insulin is the answer, because insulin is the missing link. and a lot of people are either
Okay.
born with it. That's why they call it juvenile onset diabetes. So type 1 diabetes is insulin dependent. Then type 2 is non-insulin dependent. And that has to do with you having insulin. Insulin deficiency is not the problem, but the way your body responds to insulin is faulty, is impaired. So you still have high sugar in your blood all the same. So the problem is not insulin deficiency. So you're not looking for insulin in this situation. Your body, is insulin resistant, so to say. So a lot of people who have type 2 diabetes, are strongly linked to obesity. So it's the type of diabetes that has a strong association with being obese or being overweight. So a lot of people who are overweight are most likely having type 2 diabetes, and it's usually adult onset. It's usually adult onset type of diabetes. So it's very important that you know that if you are overweight and you're diabetic, you need to do something about your weight. And if you are overweight and you're not yet diabetic, just know that it is a disaster waiting to happen unless you start taking proactive steps in maintaining a healthy weight.
I also want to find out what actually causes diabetes. Really, that thing.
The real thing that causes diabetes is your body's inability not to manage glucose appropriately. That is it. That is just it. Either type 1, type 2, or gestational diabetes. It is just that once you eat carbohydrate food, your body breaks it down into sugars. When your sugar is absorbed into your blood, your body cannot utilize it properly. The process of regulation of blood sugar control is faulty. That is what results in it, and it gives a persistently elevated blood sugar level.
So we all should now start controlling our sugar levels or something.
Absolutely.
Or how do you then monitor it on daily basis or weekly basis or monthly basis?
It's important that you know what are the risk factors, and the risk factors that we mentioned, that the genetic factors are there. If you have parents that have the same condition, diabetic, then you are at an increased risk of getting that. If you are overweight, you're at an increased risk of getting that. If you are sedentary, you don't exercise regularly, you're at an increased risk of developing diabetes. If you drink alcohol, you binge on alcohol habitually, a whole lot, you can have pancreatitis. And the pancreas is where your insulin is produced that regulates your blood sugar. You can also develop diabetes. If you are also someone who eats a lot of junk foods, that you just pound up calories and you don't burn up these calories, of course you have an increased risk of developing diabetes. So we can now say that our diet and our lifestyle plays a huge role in the manifestation of diabetes. And basically, for a lot of people that have it, being consistent with all the right lifestyle changes they need to, adopt becomes a problem. And because they are not willing to take on this new lifestyle that will help their situation, the situation only deteriorates further. So people find it hard to lose weight. People find it hard to control their diets or their appetite or their cravings. People find it hard to let go of chronic alcoholism. People find it hard to get up and move, because a lot of people, when they have people at their beck and call, domestic staff, people they can send on errands, they prefer to just dish out the instructions while other people run along, while they themselves are just seated in one place all day. While the other people are getting healthier because they are moving around, you are losing your health by the day. Because new research has shown that, prolonged sitting is like the new smoking. It carries almost equal risk as smoking.
Really?
Yes. So people that don't move, they're at increased risk of many conditions: hypertension, diabetes, cardiovascular problems, obesity, and even some cancers. Because if you're sedentary and you keep on piling up calories and you're not burning it, there are some cancers that are associated with obesity. So the more obese you are, the more your risk. So it's important that everybody gets moving, right from the smallest to the greatest. Everybody requires movement.
Exercise, right?
Yes, exercise. Your body was designed to move. You're not supposed to be static. You're not supposed to be seated in one place. You're supposed to be active. Your heart needs to pump. Your circulation needs to flow. Very, very important to make sure that your well-being is intact. Without exercise, it's just a disaster waiting to happen.
And now let's talk about high blood pressure, the one we call hypertension. Yes.
So hypertension is elevated blood pressure, persistently elevated blood pressure. Nobody would define hypertension as a single high reading. It has to remain persistently high, even after checking, intervals apart. So when people have elevated blood pressure, we tell them, look, this is a long-term treatment. It is not a 3-day, 1-month treatment.
Long term, you said.
Lifelong treatment,
Wow.
so to say. So let me just put it that way. And same goes for diabetes. So nobody should tell you that you have a 2-week treatment and that's the end. That would be a big lie, because you'll be at risk of complications and a lot of things will go wrong. So for a lot of people that are hypertensive, I think hypertension is even more, worrisome, because it shows no symptoms. No symptoms at all. You feel normal. You go about your routine activities. You wake up the way you normally wake up. You go about your normal duties, but something sinister is going on, in the background. For a lot of people who are hypertensive, they come to the hospital and you tell them, sir, you may need to be admitted. You can't go home with this blood pressure. And the man looks at you in shock and tells you, I walked in here myself.
Mm-hmm.
I never told you I had a problem. I just came in.
And now you're saying something different.
And now you're telling me to be on a bed and you don't even know when you're going to let me go. Am I that ill? I don't feel ill. And that's the problem. It gives you a false sense of wellness, and that pushes a lot of people around. So that means we should just look at this analogy. Something is not giving you signs or symptoms, but it's potentially fatal and dangerous.
Okay.
You should be looking out for it every day, because you don't know when you have it, because it's not going to knock your door and announce itself, because it's there and it will just rear up its ugly head with complications. And what are these complications? A stroke. Some people, the very first time they realized they were hypertensive was after a stroke had happened to them, especially people that don't go for regular health checks. So if you're not going to have symptoms, that means that you will feel normal and something is going wrong. Something is going wrong with your kidneys. You're at risk of a stroke. You're at risk of sudden death.
So before the stroke comes in, it means you have the level of hypertension is like plus.
Of course, the level of hypertension has been persistently elevated over a period of time, and nothing was done about it. Either it was ignored, or it was not even detected at all, or you just were not just proactive enough, about it, or you trivialized it. Because we normally have a false sense of wellness, that the fact that you can get out of your bed, stretch, take a walk, carry your bag, drive, walk on the streets, answer your calls, and do everything you do normally, that you are well. That is so false. Because a lot of people, we all know one or two people who seemed apparently well and they just dropped dead. These are the causative factors. These are the reasons why things like this happen. Because people don't know those silent things that are happening to them, that are killing them by the day. And unfortunately, for some people, the first time they know that they have high blood pressure is when their kidneys have packed up. They just notice they have swollen feet. They just notice they wake up in the morning, their eyes are puffy or facial puffiness, and everybody is wondering, why are you looking all puffy? And when you press their feet, there's a pitting edema there that takes a while to fill up back. It tells you that there's fluid retention. And when this happens, they eventually go to the hospital because they see that as a problem. They go to the hospital. When they investigate.
So every swollen feet has to do with the kidney?
Well, not in every case, but it needs to be evaluated. If you have swollen feet for any reason, the potential factors may be, you need to rule out pregnancy, you need to rule out kidney problems, you need to rule out liver problems, you need to rule out cardiac problems from the heart also. Yes. And a lot of people who have these things, by the time you are having a swollen feet already, the person may already be in cardiac failure already. The heart may be failing already in most instances, or the kidneys are packing up already, which means that is already a complication of high blood pressure. High blood pressure that is controlled will not give you complications. But the uncontrolled high blood pressure will not give you these complications. So by the time you're having swollen feet and you're now realizing that it's because you've had high blood pressure you didn't do anything about, then your kidney has been receiving some blows from your uncontrolled blood pressure. So it's very essential that wellness checks are emphasized. A lot of people should know that they need to budget for their health. Go for routine health screenings. Don't say because you don't feel ill. Don't say because you feel well. These are things we need to check. In this day and age we live in, you can't afford to have a major health challenge. We've said it time and time again that all it needs to get you bankrupt is a correct illness, a heavy one. And that's it. You see all your funds, all your savings fly away. They just grow wings. People sell their properties to manage conditions. So it's only responsible on our part for us to be more proactive.
A normal blood pressure should read what?
A normal blood pressure should read minimum 90 over 60, not exceeding 140 over 90
90
over 60.
over 60.
Minimum. Because for some people, their blood pressure is
90
low
over
naturally.
60.
You know, some people just have low blood pressure. It's okay for them. They are not feeling dizzy, no lightheadedness, but should not be lower than 90 for the upper reading and 60 for the lower reading. And it must not exceed 140 for the upper reading and 90 for the lower reading. That's maximum. So minimum to max. So if you have anything
If you cross
beyond
that one,
and mind you, no symptoms. So that's no symptoms part is what you even scare everybody. No symptoms. No symptoms. You feel normal, you feel okay, you're doing your stuff, and you know, we've had
so we should just always go and check. Always check.
everybody should check. You should check. You should know your numbers. That's why they tell you know your numbers. Your numbers are what? Your blood pressure, your blood sugar, your cholesterol levels. Know your numbers. It is mandatory. If you want a good quality of life, if you want to age gracefully, you don't want to age with stroke, you don't want to age with paralysis, you don't want to age with a kidney problem, you don't want to age running after dialysis or looking for kidney transplant. Know your numbers. And when you know your numbers, we need to get this mindset that when you know your numbers and your numbers are not right, that is not the time to panic and run away from your doctor. That is the time to actually be closer to your doctor more than ever.
Okay.
And ask your doctor, what is the way out? How can we manage this? What do I need to change? What do I need to improve on? How can I be healthier than this? How can I make healthier choices? Then your doctor will give you the right advice. That's not the time that you now avoid the hospital, because we hear that some people avoid the hospital for some very funny reasons. Because they will tell you when you go to the hospital, they will always find something. But they didn't put that thing there. They're only telling you what they are finding out. So if you are in denial of what is there, no matter how long you stay in denial for, one day it will rear up its ugly head, and it may be in a way that you won't expect, and it will be in a way that won't be nice at all. So why not nip things in the bud in the earliest stages of the condition before things get out of hand, when it can still be easily managed and when no major damage has been done? Because a lot of people, apparently because of fear of the doctor's findings, will not come to the hospital. I've heard people say the reason why I don't come for checks is you people will always see something. There's no time I come, you will not see something.
Oh,
but, is
really?
it not better you see the thing and then you start taking steps?
You
in
must
order
see
to
something.
correct it? You must see something. But that is the essence of you coming for the test.
Oh, my
so,
God.
So why are you coming for the test if you don't intend to find something? You're coming for the test to screen yourself, to check yourself. It's a wellness check so that if there are any areas you need to work on, we can pick them up early. If we are picking up any abnormalities, we can inform you about them, and you start making healthy lifestyle changes that you need to change to make sure that your health is restored. You know, if it's something reversible, you can reverse it. If it's something not reversible, at least you can manage it considerably well to an extent that you are not having complications and you have a good quality of life. But for you to be in denial absolutely and saying it is not there when it is there, one day the thing would just tell you, I've had enough. You better recognize my presence, and this is me, and I'm showing myself to you koro face to face. Then what do you do at that point in time? Then you start looking for a miracle. We've seen people that have wasted valuable time, you know, that they would have used to manage their conditions well. And when there's a complication, they run to the hospital expecting the doctor to perform a miracle. I think it's not fair to the healthcare workers, because you're expecting them to reverse something that did not start today and something that has already done much damage to your organs. So we need to take more responsibility for our health, and we need to know that, look, it's a personal decision. Nobody can make that choice for you. Nobody can take that decision for you. It's a personal decision we must all make, that if you want to remain healthy, it's in your hands. You have a functional role to play. And good health doesn't just happen to everybody. You have a part to play.
I want to say that again, because a whole lot of persons are listening actually. Knowing your numbers means you should go check your what again?
Your blood pressure, your blood sugar, your cholesterol, even your weight, your body weight, even your body mass index. They are still part of your numbers. Know your numbers. Know when you are becoming overweight. Know when your weight is getting out of hand. It is not just that, when did I become 100 kg? How did it happen? And you'll be asking, and sometimes when they ask that, I'm asking, who are you asking that question? That how did you become 100 kg? When you were eating, downing all the 10 plates of eba and all the pounded yam and the semo, what were you thinking? When you were drinking alcohol, binging on it, you don't think it was going to have an effect? When you sit down for long hours and you don't ever exercise, what were you expecting? Of course, you're going to add weight. It's just normal. There are certain things that will just happen when you don't do certain things. So let's not act all surprised when we're now seeing the effect of our habits. So we need to be proactive and we need to take the right steps, because that is the only way we can curb all these things. Otherwise, we'll just keep seeing a rise in it. And I think it's worrisome, because statistics tell us now that in Nigeria, 1 out of every 3 adults is hypertensive. That's worrisome. That means if you close your eyes and pick any 3 adults randomly, one of them is hypertensive. That is scary. That sounds like an emergency. We need to do something about it. Otherwise, stroke, kidney problems, and all these things.
And diabetes and high blood pressure are like 5 and 6, Abi?
Because they have similar symptoms. I mean, similar risk factors. They have similar risk factors. For instance, if you are obese, you are overweight, you are not exercising, you are at risk of both of them. If you are sedentary, you are at risk of both of them. If you are drinking alcohol, you are at risk of both of them. If you have a positive family history, both of them. So it's very necessary that this wellness checks we're talking about is not the doctor looking to eat your money. It's not the doctor wanting you to come to the hospital by all means. The truth is, we are tired of seeing people with complications presenting, and unfortunately, by the time they present, the condition is irredeemable. It's quite painful as a professional to see that, because those kind of things really don't need to happen.
Okay.
If the right steps were taken early enough, because they are quite preventable.
Okay, I know that there is that's for high blood pressure. I also know that there's something called low blood pressure, right?
Yeah.
Tell us about it.
Low blood pressure, that's hypotension. And that also results from people having lower than normal blood pressure. And in such cases, like I said, some people's blood pressure is naturally a little low, and they're fine. They function normally. But you need your normal blood pressure for proper perfusion of all your organs. So if your blood pressure is lower than what it should be, then overall perfusion to the vital organs will be hindered. And of course, that can results in decline in the function of those vital organs. So for instance, many conditions can make people have low blood pressure. For instance, a woman who is bleeding heavily, or somebody who has had an accident and is having hemorrhage, bleeding from a major blood vessel, losing large amounts of blood, the blood pressure drops. For somebody who is repeatedly having diarrhea and vomiting, losing fluid and electrolytes, the person can also have low blood pressure. Before the person gets proper help, being rehydrated and all that, the blood pressure will go low. You can also have what we call septic shock, where a person has an overwhelming infection in the bloodstream. It can also present with hypotension, where the blood pressure crashes because of the overwhelming infection on the person. It's called septic shock, and it's potentially fatal. And for some people who are hypertensive and are on medications, and maybe they are taking the wrong dose of the medication, they're taking higher than what they should take, or their blood pressure now is better than what it was at the beginning, but because they're not going for follow-up visits with their doctor, the doctor should have tapered down the dose of their medication. They're still using the high dose they started with. They can also be tipped into hypertension, because the antihypertensives they are using, is now having an overwhelming effect on their blood pressure. And then you can have what we call anaphylactic shock, where somebody gets in contact with some substance, maybe a drug or an injection or an insect bite or something, and the body has a terrible explosive allergic reaction to it. The person can go into shock and can also present with hypotension. And there are other syndromes like Addison syndrome that can also lead someone to have hypotension. It has to do with the adrenal glands, not being effective in their function, and that's adrenal insufficiency.
But do they have the same symptoms?
Well, typically, people that have hypotension usually feel faint, lightheaded, they feel fatigued, no energy. Some of them can even pass out. And then in some cases, like I said, if it's overwhelming, you can have damage to the organs because they are not properly perfused, because you need a considerable normal blood pressure to ensure optimal blood perfusion to the organs. So you can have end organ damage eventually in such people. So it's important that if your blood pressure is lower than 90/60 for any reason, and you're beginning to feel faint, you're beginning to feel dizzy, feeling lightheaded, please, it is an emergency. Go to the nearest health facility where you'll be resuscitated. They can give you fluid resuscitation intravenously, and they can also give you some medications that we have some injections that can jolt up the blood pressure and bring it back to optimal levels.
Okay. Like I said, everyone, you're free to send in your messages. Yes, yes. You're free to send in your messages right now. And I'm going to read it out to the doctor. I don't take calls on the show. All I read is your messages so we can analyze it well. 081 WhatsApp, okay? 081 717 56338. 081 717 56338. Okay, that's the WhatsApp number. Just you can send in the WhatsApp messages. I will read it out quickly. Someone is asking a question here. Let me quickly look to it. Doc, you said tingling and sharp pain on the hand and the leg, like once in 2 months, 1 inch, one each from the base at the middle between my thumb and index finger, always on my right hand. Though I feel this very sharp pain, usually about 3 seconds, just once, and that's all till 2 or 3 months time. Please, does it mean I'm diabetic? This is Francis from Oshodi.
No, not necessarily. It may not mean you're diabetic, but if you have a positive family history of diabetes, you can't be wrong to have your sugar screened. But you should also make sure that you're doing some exercises, making sure some hand exercises to make sure that circulation in your hand is fine. And then you may ultimately just see an orthopedic doctor just in case you may have a little strain on the tendons,
Okay.
in controlling your hand movement, because the tendons are structures that attach your muscles to your bones. Because when you do a lot of typing, when you do a lot of writing, and gripping or holding things, sometimes we put a lot of strain on those structures, and you can have a tendinitis. That's an inflamed tendon and all that. So you can see an orthopedic doctor for that. They may place you on some anti-inflammatories. You may have to do some ice compress, or in some cases you may need to have some steroid injections, but you need to see the right doctor so that your case is thoroughly investigated. But you won't be wrong to check your blood sugar if you have a positive family history of diabetes.
Check your blood sugar, right? That's what he said. Okay, let me read this other question here. Good morning, Doc. On the day my sister had a stroke, her blood pressure was checked and her blood pressure was okay. Although she doesn't like to take her BP drugs except when she checks and it's high. What must have happened? And she is a nurse. Madam Florence is asking this question.
Well, that's a very important question, because cholesterol being elevated can cause a stroke. What is a stroke? A stroke is basically a part of the brain not getting perfused with blood and not getting blood and oxygen. So
a part of the brain?
Yes, a portion of the brain not getting properly perfused. Blood not getting to that area properly. And when that happens, then the function of that place is impaired. And the way it is that every part of the body that is controlled by that aspect that is injured will be affected. And most times when people have a stroke, they have facial asymmetry. Half of the face may appear drooping, and you may also notice that speech is slurred. You may also notice that they have weakness in one arm and leg. Mobility becomes a problem, and all these are potential signs of a stroke. So a stroke can result from uncontrolled blood pressure. It can also occur from uncontrolled blood sugar and high cholesterol levels. So anything can clog the arteries that supply the brain, those essential blood vessels that get blood to the brain. If they are blocked either by cholesterol plaques or they are blocked by blood clots, you can have a stroke. I would probably think that your sister could have had high cholesterol levels, or she could have had a blood clot clog one of her vital arteries supplying the brain, resulting in that stroke. Particularly if it is an ischemic stroke. An ischemic stroke is a type of stroke that it's a blockage in the blood vessels that is stopping blood from getting to the brain that results in the stroke. But you can also have a hemorrhagic stroke where the arteries actually do rupture, the blood vessels actually break open, and you see blood filling, the inside the skull, bleeding into the brain and all that. So that gives a lot of pressure, intracranial pressure in the brain, and results in all sorts of complications as well. But in most cases, when people do have ischemic strokes, it's usually from high cholesterol or blood clots clogging the vital vessels supplying the brain. And when that happens, the first thing you do is to send for a brain imaging, brain CT scan. You go for that immediately so that you can quickly differentiate whether it's a hemorrhagic stroke or an ischemic stroke, and then what part of the brain is affected. This helps your neurosurgeon and your neurologist to decide on the best line of treatment. That's why when a person has a stroke, that's not the time to take the person to a traditionalist or to a church or somewhere. It is best you go for an imaging, and time is of the essence in a stroke. The earlier you start intervening, the better.
The better.
Yeah, the better the outcome. And then you start instituting physiotherapy early so that the person starts getting restored function of the limbs. Get a speech therapist so that the speech starts improving on time too. All these, give you favorable outcomes than you delaying care.
Good morning. Since your guest, the doc, says high blood pressure and diabetes requires lifelong treatment, does it mean both ailments are incurable?
Absolutely correct.
Incurable?
Yeah, because a cure means that you take something and it's gone. That's what it means. A cure means you take something, a medication, a treatment, or whatever, and the condition is completely eliminated or removed completely without a trace. Then that is an absolute cure.
Okay.
But for that to happen in diabetes and hypertension, no. But there are conditions, they are called chronic non-communicable illnesses. So it's part of that class of.
Doc, hypertension and diabetes used to be very, very scary. Sometimes some people tell you some of these things kill faster than AIDS. I mean, it's better to have HIV than to have all of these things that will make you feel, go deformed at home. You really cannot do things anymore, and
No, but the truth is, like we said, there are people that have these two conditions, and unless they tell you, you would not know.
But they're rare.
Do you know why they are rare? Because people that listen to instructions are rare too. People that are compliant to instructions,
Okay.
they are few too. That is why it looks like it's rare. It is rare but achievable. People are not consistent with information they get. People come to the hospital one time and they disappear for 2 years. You don't see them again. They are back when they have a stroke. People are on their medications that a doctor placed them on, and by themselves
after 2-3 weeks or 3 months
they take themselves off the medication without the doctor. Yeah, they just decide. They just wake up one day, I'm not taking these drugs again. I'm not. All their children will form quorum on their head. You must take this drug. Don't put us in trouble. They just say no, I'm not taking it, and they stand by it, just like that, not caring what the consequences will be, not caring what complications can result. And it is not like they are doing it from a place of knowledge. Because if they know what is at stake, they will not even dare.
But Doc, some will tell you, well, by faith.
That is another topic that I like addressing.
I promised bringing a doctor. A pastor here.
Yes.
Who let's look at these two things.
Absolutely.
Medicine and faith.
Yes. We need to do that. We need to do that because the truth is that science and faith, they actually are complementary. They don't negate each other, and that's the truth. They don't negate each other. You can't say because I want to be a scientist, then I can't have faith. Or because I have faith, then I cannot be a scientist or think like one. The truth of the matter is science is a body of knowledge that God has given you and the application of that knowledge. So if you have knowledge that is not applied, of what use is the knowledge? If you have knowledge in your hands and you are not, and it's not producing the effects that is positive in your life, that is not improving your well-being or improving your quality of life or extending your lifespan, then of what use is that knowledge? Then you're as good as somebody who doesn't have that knowledge. Because the truth of the matter is, a lot of things about science will tell you this is a condition. Research has gone through this condition, and then we understand how this condition presents. We understand how this condition manifests. We understand the line of treatment or management of this condition. And this has worked for a number of people. And people that have followed this trend have lived a very good quality of life. In fact, they've lived into their old age without complications. And you have evidence to back that up. Then somebody else somewhere prefers to do the opposite and still expects a good outcome.
Okay.
It's almost impossible. How can your blood pressure remain elevated, or you don't even go to the hospital at all to check? So you are not even sure whether you even have it or not. You have never checked your blood sugar before. You have never checked your cholesterol levels before. And you expect that the day your body says it has had enough, it wants to shut down. You now expect that you praying or going to church or going somewhere or asking somebody to do something for you will really make a difference. The truth is, yes, we believe in God and we believe God can do all things, but you have a role to play in this. You cannot leave to God what is in your own hands to do. You cannot have a plate of rice in front of you with your cutlery there, and you are praying, Father, please raise this fork, feed me. I want this plate to be empty. I know you can do it. It doesn't cost you anything. In fact, you can raise this plate without me touching it at all, and the food will be in my belly. Yes, God will do it, but it's at his discretion. We can't order God. We need to get that in our heads. That God is almighty. Hunger go. In fact, dog go pour the plate away. You go just see your food on the floor. But the truth of the matter is that in as much as God is almighty, he has all the power, he can do everything. The truth is that what is in your hands, he would not do. What is in your hands to do, he will not do. You have a role to play.
Someone said God will not do for you what you can do for yourself.
Absolutely, because that is...
Now, in one way you know Sabi do, now they come in.
God intervenes. That is why they say God is supernatural. God intervenes when you have done all the things in the natural. You can't help yourself again. You look to him, then he intervenes. He knows, this person don't try. At least the thing where he puts in his hands, he has maximized it. You think all the parable of the sower and the parable of the talents that God gave us in the Bible. They are examples of these things. He wants to see what you have done with what he has given you first. Then he will now multiply it. Even when he wanted to feed 5,000 people, he still said, what do you have in your hands? He still collected. He could have rained all the food from the sky, but he still collected the 5 loaves and the 2 fish and blessed it and multiplied it. Telling you that what is in your hand is
collected it back.
It means that your efforts matter. Put your efforts on the table. Let me now help you multiply.
Right on, Pastor.
Yes, so
Don't
yes, it's still part of it.
Keep saying it.
It's still part of it, because we need to use this analogy to make people understand that, look, you have a role to play. You can't just be saying everything God. Because otherwise you meet yourself in a place where you don't expect. And even God will tell you, you had everything in your hands. It is so painful that people have the medications they need in their drawer. It is there. And you tell me that a person still has stroke when the BP medications are there or the sugar medications are there.
Okay. Dr. Pastor, Doctor. Oh, God. Doctor, I'm from Ikotun. Silva is writing. He said, I'm having swollen feet. I'm 8 months pregnant. Hope it's not a risk.
Well, that's a good question. In pregnancy, you have a lot of fluid accumulation, so it may be normal in pregnancy. But all the same, I hope you're going for your antenatal, because when you go for antenatal, they check your blood pressure. If your blood pressure is ever high, then that may be a risk. They collect your urine sample. They always check whether you have proteins in your urine. Very important. So when you go for that antenatal visit and they're always asking you to give your urine sample, pay for urinalysis, it is not just that they want to eat your money. It is because they are looking for important things. They're trying to screen out important things that can be potential problems for you and your baby. So you may need to elevate your feet, make sure you ambulate, you move around well, as much as you can, exercise moderately, and you'll be fine. But always be on top of your blood pressure and your urine checks when you go to the hospital.
I have a sharp pain on the center of my chest that later went to the right side, down to my pelvic, and later gives me pain in my stomach. I'm an ulcer patient. Only don't talk.
Correct. So you're right. That's the problem you have. You probably have what we call GERD. That's the acid reflux. So part of the stomach acid, is refluxing into your gullet, your esophagus, and is causing some irritation and is giving you that central burning sensation in your chest. So what you need to do is first and foremost, know your triggers, avoid spicy foods, don't skip your meals, don't take any analgesic a doctor has not recommended, and make sure that you don't drink alcohol, you cut out smoking, and then your stress management is very key because stress can worsen your ulcers. Don't eat late into the night, don't have late dinners, and don't lie down immediately after eating. And make sure you go for your H. pylori screening. But if the symptoms persist, you may need to see your doctor and go for an endoscopy to investigate further.
Good morning. I'm taking 2 eye drops. I no go call the name. Make I no give them cheap advert. They are very expensive, according to him, for him to buy. And now he wants to change the eye drops.
It depends on what
Because
eye
some-
condition
some-
you're managing.
Okay.
Yeah, so if it's glaucoma, you want to reduce the pressure in your eye. If the eye pressure is high,
So how do I change eye drops?
you can't change eye drops by yourself because these drugs that you're even using, I believe it was
And
a
you know
doctor
Nigerians
that
are used to
recommended.
that.
No,
Let's
that's
we could get the cheap one.
no.
Eye drop,
Because
na eye
because
drop.
even the one you're using now, I want to believe it was an eye specialist that recommended it for you because your eyes are delicate, very important sensory organs. Without your eyes, it's a problem. So definitely, I want to believe that if a specialist has recommended that, if you have any concerns about the eye drops, you should go back to the specialist and ask for other options that are available. I don't think it's in your place as a non-medical person to want to recommend an eye drop for yourself because whatever you are choosing as another alternative may not be appropriate for you and may only worsen your situation.
My name is Elims. I have been taking BP medication for about 8 months now. I notice when I take the medication, I urinate a lot. It doesn't allow me to sleep. I explained to my doctor and he said I should continue, but there is no improvement. I have to stop it myself so I can sleep. What's your advice?
Well, the truth is, yes, there are different classes of antihypertensives. A class of them called diuretics will make you pee often. So you would notice that you're passing out a lot of urine because diuretics push out excess fluid from your body, and that helps in your blood pressure regulation. I would advise that please don't stop your drug on your own. If you have concerns about the class of drug that your doctor has placed you on, there are other classes of drugs that may also be useful,
Okay.
and beneficial that you can use. So you have to go back to your doctor, lay your complaints, and let your doctor know that it is actually disturbing your sleep. He can give you alternatives. Alternatives exist. We can't mention those alternatives here, but go back to your doctor. But that's not a good reason for you to completely stop your antihypertensives because we mentioned how important it is for you to be on your drugs.
Having serious waist pain and I don't walk upright again. I don't even know if it affected my lumbar bone. Please, what can I do now? Because it's almost 2 years. I've been taking painkiller and no result. 2 years.
It's important that you go to have an imaging done of your lower back. Lower back pain, chronic low back pain is a common complaint for many people, either because of the nature of their work, their posture, maybe they're overweight and all that, or maybe the number of pregnancies they've carried if they are women. So it's very important that you go for an imaging to actually know what kind of condition you have. Is it a spondylosis? Is it a prolapse, a disc prolapse? You need to know. So you go to see an orthopedic doctor. An orthopedic doctor will check the x-rays that you've done, and if he thinks that you need to do some further checks like an MRI, if you have some nerve impingement, an MRI is going to show that, and then your orthopedic doctor will place you on analgesics, muscle relaxants, and may also recommend physiotherapy for you. So it's very necessary that you go through this route because that's the only way you can get better. See the orthopedic doctor, go for imaging tests. They place you on muscle relaxants, painkillers, and physiotherapy.
Abraham is saying, please, what is the final cure for ulcer that will cure it at once? I'm suffering from it.
Well, for ulcer, you have 3 major risk factors or causative factors. You have one, the acid production, excess acid production in your stomach. Then you have people who they got it from either the kind of drugs they use, like ibuprofen, aspirin, diclofenac. We call them the NSAID family. They worsen your ulcer. When you take those painkillers, your ulcer worsens. Then thirdly, the H. pylori infection. H. pylori is a type of bacterium that resides in the digestive tract, and predisposes you to inflamed, lining of the stomach that we call gastritis. So you need to screen for H. pylori in your stool. Do a stool test for H. pylori. If it's positive, there's a triple therapy regimen for it, which you would start for a length of time. There's a duration of treatment for it. Your doctor would advise you on that. And once you eliminate the H. pylori and you know your triggers and you avoid them, you should be fine. But if your symptoms persist, you will need to go for what we call an endoscopy. That's the gold standard, to know the extent, the number of ulcers, and if it's a complicated ulcer or not. And then, of course, if you need other interventions, like maybe take a small biopsy during the endoscopy, if they see any suspicious lesions, they're able to take it out to investigate further. But please, if you have ulcer and you go to the toilet and you notice your stool is darker than usual, that is an emergency. Run to the hospital. You may have
Darker than usual.
Yes, dark tarry stools. You may have bleeding from the ulcer. You may have a perforated peptic ulcer. So it's an emergency that you should not ignore.
All right. All right. This person is saying, okay, let me look at it properly. No, I did not miss that one now. I did not. Okay, it said, good morning, doc. I can drink water for 10, whatever, and urinate for 10 times. What are you saying? And if I don't drink water at all, I don't urinate. Can eating of different types of fruit cause diabetes? Yeah. I used to have sharp pain inside my, what do you call it now? A sharp pain inside under my left breast for a second, I don't understand. Maybe you have to look at that message again and send it, okay? Sorry about that. Someone is saying, good morning, I'm Emmanuel from Sele. Okay. 2 weeks ago, I was feeling dizziness and kind of weak. So what I did is to buy malt and milk. I later went to the hospital. The doctor asked me to test for sugar and blood level, which I did. The doctor said my test was fine. And all of that, right?
Okay, and you were feeling dizzy? Oh, okay. So if you're feeling dizzy, there are a number of questions you would need to ask you. I think the doctor did well to check your blood levels, your hemoglobin levels, your PCV, very essential, your blood sugar. We should also now, ask you other questions, your stress levels, your quality of sleep, and if you're undergoing any form of stressors. Because basically, some people confuse dizziness with some other symptoms that are similar. You may have what we call vertigo, where you have a spinning sensation, like the room is revolving, and people still call it dizziness. So if your blood sugar is fine, your hemoglobin is fine, your blood levels are fine, and you have a sensation that the room is spinning, then you may need to investigate further. You may need to see an ENT doctor to check your ears, especially the vestibular system that controls the balancing of your ears.
Okay.
And then that would help us know if something is wrong in that regard, and there are drugs to help with that.
Are there foods to avoid when asthmatic and also when having elevated BP?
Yes, when you have elevated blood pressure, it's essential that you minimize salt intake, and it's also necessary that you cut out junk foods and processed foods. You need to reduce your cholesterol, especially saturated fats like those you get from butters and margarines, and red meat consumption too must be minimized if you are dealing with high blood pressure. Of course, if you are asthmatic, asthma is an allergic reaction. It's a chronic inflammatory allergic reaction that affects your respiratory system. So advice to most asthmatics is know what your triggers are and try to avoid them as much as you can, because a trigger for a person is different from a trigger for another person. So if there are certain types of foods that you've noticed gives you more frequent episodes of acute asthmatic attacks, then you may need to avoid them. And environmental factors too, of course, cold, dust, fumes, whatever you're exposed to in the environment that are potential precipitants, you try to stay away from them.
Okay. I ran some tests few months ago and discovered I have ulcer, which was surprising to me. I was placed on medications to tackle the H. pylori, um, and felt better afterwards. But once in a while, I do feel a slight hot sensation in my chest. Does it mean I require continuous treatment?
The hot sensation you have in your chest is most likely due to acid reflux. So when you have acid reflux, the acid in your stomach, kinds of flows back into your esophagus and irritates it. And when that happens, you have that burning hot sensation in your chest. So we advise that you watch your meals, cut down spicy foods. For some people, even fried foods or even things that produce a lot of gas can give you such effects. Fizzy drinks can also give you such effects. So you try as much as possible to eat your meals in smaller portions. Don't overeat at each time, and don't eat late into the night.
Okay.
And by the time you are going to bed, make sure you've had your dinner 3 hours before your bedtime so that your body is not struggling to digest food while you're lying down. Because the closer the interval between your last meal and your lying down, the higher your risk of developing acid reflux. So it has to do with lifestyle and dietary changes. And you always have your antacid handy.
Okay. Voice of the People, 90.3 FM. I would have a conversation with, like I told you, some guests in the studio right now. Okay? And when we're done, just few minutes, the doctor will answer more questions. Okay? Stay there.
Lagos, are you ready? The Niger Landlord Summit 2025 is here. Join us on Saturday, 1st November 2025 at the Golden Tulip Hotel, International Airport Road, for the biggest gathering of real estate minds in Nigeria. Come and discover how to profit from the booming housing demand. Nigeria, explore funding and investment opportunities that work, gain insights and government housing policies shaping the market. Experience the latest prop tech innovations transforming property ownership. Network with top developers, investors, and policymakers all in one room. Don't miss this power-packed event. Registration is 50,000 naira only, with full access to sections, exhibitions, with premium networking and refreshment. How to register? Make payment to VUPFM account number 112-416-8488. Again, 112-416-8488. Zenith Bank. Send your proof of payment via WhatsApp to 0707 115 4297 0707 115 4297. The Niger Landlord Summit 2025. Profitability in real estate management, prospects and opportunities. Your gateway to wealth through real estate. Powered by VOP 90.3 FM.
All right, welcome back, everyone. Voice of the People, 90.3 FM. My name is Jude Ikami Jude. Now, let's talk something way different. Like I said, just a couple of minutes to get this information that you need. And when you fly with it, it's going to be good for you. AI, money, wealth, and all of that is putting itself together to present something in your Aza. Okay, please talk to us about it. Good morning to you first.
Good morning, Nigeria.
Good morning.
Yes, this is Lami Orale, and I am your go-to girl for anything money. Okay, so everybody knows that right now artificial intelligence is trending, and unfortunately, what we hear is that artificial intelligence is going to take your job. It's going to get you off the work and get you on the streets and all of that. So people are looking at how they can actually integrate artificial intelligence into their lifestyle. So we have come with an opportunity that can actually help you do that, and also help you upgrade your earnings. And what we're talking about is artificial intelligence integration into your income.
All right.
Now there's this robot. It's known as the MEVBot, and it's been in the market for like 2 years, trading effectively in the finance market. And we've been using it for quite a while now,
Okay.
4 months running, and it has delivered. So we asked ourselves, why not tell the world how this robot actually works? Because yes, everybody needs to have an extra source of income,
Okay.
and there's nothing wrong if you can have something working for you on the side, delivering money to you while you sleep or while you are attending to your normal daily business. So that's why we are here, to invite the world to see what these robots can do for you. You don't necessarily have to leave what you are doing currently. All you just need to do is plug it in and it plays. And that's why we're here.
The robot is gonna. I want you to really break it down.
All
You
right.
know, let's understand.
Okay, so basically, in the world of trading, you can actually employ the robots to trade for you. Now, in the past, we've seen cases where robots trade and you are getting like 85% wins, or you are promised 85% win or 15% loss. That's yes, the robot cannot trade 100% full. But what we discover with the MEVBot is that it can actually do 99.8% win rate. That means leaving a loss rate of 0.2 or 99.4. We've run that statistics. We ran it in July, August, and September, and it has really proven good. Back to back, it comes back with profit and it delivers to you on daily basis. So we're like, this is fantastic. So we don't have to like lose our money, and then you understand what I'm saying.
Okay.
And we don't really you don't really need any trading skills, because
AI is here to do it for you.
exactly. Previously, what we're thinking is, oh, for me to be able to win in trades, I must know how to set my trades. I must know how to study the market. I must know how to analyze technically and fundamentally and all of that. But once you employ the MEVBot, you leave all of the work to it. The MEVBot does not consider whether bull run or bear season. It works the way it has been programmed. The algorithm is programmed to scan the market and get in and get out within 1 minute. So it makes it really fun.
Okay. I
for
think I love this.
anyone, yes.
Yeah.
For anyone who is getting involved, just
You don't trade anytime, anyhow.
you don't just
You
trade
know?
anyhow. In fact, you don't really have to trade anything. All you just need to do is get the robot, plug some funds into it, and it's like trading for you. That's how.
Let me hear from the young man. You wanted to add to. I mean, you want to add to what she said.
Yes,
Listen.
this is actually a new technology.
Exactly.
This is actually a new technology in blockchain space.
Okay.
So a lot of people don't know about this opportunity. And this is a new opportunity that is actually putting some profit inside our pocket on daily basis. Just plug in, leave it there. It will start working for you. And you are in control of it. So nothing to fear. So if we plug in, if we use this opportunity, minimize it, I think it will actually help so many Nigerians today, because putting food on the table is very, very difficult. Some people who are living on salaries alone, they can't even care for their family. Talk more of paying bills. And every day we pay bills, we make expenses. We also need to be making profit on daily, because
True.
since we spend a daily, we also need to be making profit daily. So that is the essence of this new technology in blockchain space. So we need to utilize it. And one thing my mentor usually says is that decision make men. So we all need to make
Decision make man.
Yes. So
love
we
it.
all need to make decisions today to change our financial status. If not, we know,
Now you sabi.
yes.
just talk about.
So now you sabi.
Okay, but now for some persons who are interested,
Yes.
what would you want them to do?
All right. So we're coming up with a seminar this Saturday, and we're going to be showing you exactly how the robot works and how you can maximize it. Another thing I'd love to say is, I know that a lot of Nigerians are afraid because of the past incidences that have happened, and they're skeptical. But what if I told you that this particular robot, you can track every transaction that it takes real time to the blockchain? And this is not my first time of talking about the blockchain. The blockchain is a system that cannot be doctored. Let me just use that language. So if the system all transactions can be traced to the blockchain in real time, definitely there's a trade going on. Unlike other previous platforms that will tell you they are actually trading, but the fact remains they are sharing your money amongst you and your friends. So we are going to be showing you exactly how the system works, and all you need to do if you're interested is to send book me to 081
081
03
03
38
38
60
60
43.
43.
I go again.
Mm-hmm.
081
Mm-hmm.
03
Mm-hmm.
38
Mm-hmm.
60
Mm-hmm.
43.
Mm-hmm.
Now, once you send, please WhatsApp only. WhatsApp. Or, yeah, WhatsApp only, because you actually need an Android set to be able
Phone,
to use
right?
it, to be able to
Beautiful.
maximize this opportunity.
Okay.
So if you have an Android and you can go on the internet, you can buy data, then you should maximize your data to the best, to the fullest. So just send your book me or I'm interested to 081 03 38 6043, and we're going to give you
Call it slowly, please.
all right 081
081
03
03
38
38
6043.
6043.
Yes.
Okay. You want to say something?
Yes.
Okay.
So if you're among the first 20 people to send book me or yes to this opportunity, we are going to give you a special reservation. So we are going to give you a special reservation. Remember, this business is not for everyone.
All right.
It's only for those who are ready to change their financial.
Not for everyone.
Yes, it's not for everyone.
Exactly. I think I should just mention as well that the robot is not coming for free. So what I'm going to do is, once you're able to make it to the seminar venue, the first 3 people, that's going to be on me now, the first 3 people will get a free robot.
Wow. Wow. Nice,
Okay.
nice. Okay.
Okay.
So remember
Okay.
that.
That's
If-
good.
So remember that your future is in your hand. Always remember that. And if you change your decision today, you will change your address.
Exactly.
Let me repeat what I said. Say, if you change your decision today, you will change your address.
Your Go Village.
Yeah.
Now, so now, you know, pass like that.
So if you want to change your financial address, make some good decisions today.
Yes.
Make sure you attend this training coming up Saturday, 11th October 2025. If you send yes to this opportunity, we will send you the address of the training.
And the first 3 people gets a free robot.
Okay.
The first 3 people
First
to sign up. To
3.
sign up right now. To
Okay.
sign up.
Sign up.
Yes,
Okay.
yes.
First 3. First 3. Don't make good decision. Or don't change your address. Don't go to. No, come up for Lagos. But thank you so much. The number again, please, before you go.
Okay, so the number is 081
Mm-hmm.
03
Mm-hmm.
38
Mm-hmm.
6043.
Mm-hmm. Slowly now for the last time.
081
Aha.
03
Mm-hmm.
38
Mm-hmm.
6043.
Mm-hmm. Thank you so much.
You are welcome.
Thank you so much for coming.
We
Yeah.
look forward to seeing all of you. All of you.
Thank you indeed. Yeah.
You are listening
to your number one station.
to Voice of the People 90.3 FM. Do not touch that dial.
Voice of the People 90.3 FM. All right, everyone, welcome back. Okay. Dr. Adeogun is still here. Good to have you join us.
Thank you.
You're still here. Okay, now let me quickly read the questions. My last blood pressure check was last Sunday. It was 143/84. Sugar 193. I'm having constant headache almost every day. Why?
If you're having constant headache, that's something you should investigate, because sometimes a headache may be something trivial from stress, not sleeping well, even dehydration, you're not drinking enough water, or you having some kind of visual distortion, some kind of refractive error with your eyes, and you need to have your eyes checked. And even increased pressure in your eye can also give you headaches. But it's important that you don't do guesswork. Go to your doctor and find out, what could be the cause If you need to check your eyes, if you're above 40, please go and check your eyes. Go for an eye check. You may be putting too much strain on your eyes. Then if you're not drinking enough water, you take a lot of fizzy drinks and other kinds of drinks, but not water, you may also need to improve on your water intake. Your stress levels, make sure you manage stress well. If you're not getting up to 6 hours of sleep, please seek help regarding that and improve your sleep hygiene. All those would add up. Everything is not painkillers. It may just be that you need some corrective lenses, or you need to improve your sleep, or check the pressure on your eyes, and then you have an answer to the headache. Check your cholesterol levels too, very important since you're hypertensive.
Okay. Thank you so much, Doc. When someone is having pain in his scrotum, what does it mean?
Pain in the scrotum, it may be normal in some cases. It may not be anything serious, and it may also be other things like varicocele. We've mentioned varicocele when the surgeon was here the other day with the dilated plexus of veins in the, surrounding the testis and all that. And then it may also be, you may even have microlithiasis, some tiny stones there. And then you may also have, some infection. Scrotal pain, depending on how it starts, can help us differentiate it. If it's a sudden pain, that's a sudden horrible pain in your testis and it's causing malalignment of the testis, you notice that one testis is hanging differently from the other, runs to the hospital because that may be testicular torsion, which is an emergency because that cuts off blood supply to the affected testis, and you may lose that testis when it becomes gangrenous, when blood is not getting there. So that is of sudden onset. It happens suddenly, and it happens in younger people. But if you're dealing with this one started gradually over time, is worsening, it could be what we call.
But once, like someone asked, one scrotum is okay. Like the same question. I mean, there's a question here like that. I said, a scrotum is one is always bigger than the other, right?
They are not exactly identical.
Okay.
They're not exactly identical in size. But the issue is not even the difference in the size. We're now concerned about what is causing the pain. So if it's of sudden onset and you're a young person and it is an intense pain and you notice the alignment of the affected testicle different from the other one, it may be testicular torsion. But if it's of gradual onset, it may be what we call epididymoorchitis. That is inflammation of the testis and the epididymis. And it's usually from STIs most times, that were improperly treated. So you need to investigate. Go for a scrotal ultrasound scan. They're able to tell you exactly what is seen there. If it's varicocele, it will be clear. If it is microlithiasis, it will be there. If it is hydrocele, it will be there. Or God forbid, if it is a tumor or anything, it is going to be there. So it's very necessary for you to go for a scrotal ultrasound scan and see your urologist immediately.
Okay, Doc. Again, I'm having the message is plenty. I can tell you it's close to like 50 right now, and my time is almost up. I hope I'm able to treat yours today. If not, you will still send again next Thursday, all right? Or not next Thursday, the other one. Okay. Let's look at it. Good morning. What about somebody who lives in a flat and has shop there? What are you trying to say? I can't understand you. Okay, let me go here instead. My friend's pulse rate is low, ranging from 43 to 61, and the blood pressure is normal. What will she do to increase the pulse rate?
Well, some people have what we call sinus bradycardia. Bradycardia is when your pulse rate is less than 60. Normally, we don't want the pulse rate to be lower than 60. But by the time you are now having in the 40s, you need to see a cardiologist. You need to go for an ECG and for some other cardiac checks, and also do a thyroid function test just in case the person is having hypothyroidism. The thyroid may be underactive and give you low pulse rate. It's very important that you go for these screenings and see a cardiologist.
Okay. I'm 38 years and I've been managing my high BP since 10 years ago. But I've been on drugs. Just that the BP don't ever get normal readings until I checked it the third time. Some people said it's fear or anxiety, but it doesn't get lower than 140/90. And then the second or third check, make I mention this drug now. Doctor, you know all these things they take, they treat this one. No one gives people free. In fact, he's on that drug for over a year now. What's difference in blood sugar test done using the small machine and the one that will be done going through the bigger machine?
Okay. First and foremost, the person is right that under certain conditions, your blood pressure may seem a little elevated than usual. So most times we ask that before you check your blood pressure, you are in a relaxed state. You know, if you're just climbing a flight of stairs or you were just coming in from traffic, just try to rest a bit and then get your blood pressure checked. That gives you a more objective reading. And once you check your blood pressure and you notice that over time your blood pressure is still not optimal, you either go back to your doctor and have a review of your medications. It's either some of your medications need to be changed or the doses need to be adjusted. And in some cases, of course, you need to check your cholesterol levels, your sleep, quality of your sleep, all those matter. If you have not lost weight, no matter the drug you are taking, if you are still overweight, you may still have some issues with controlling your blood pressure optimally. Okay. Your salt consumption, your alcohol consumption, all this, your caffeine consumption, all this still play a role, you know, in your blood pressure. But ultimately, if you are doing all this lifestyle modification and you're following your drugs, you should be able to achieve a good blood pressure control. And in some people, please, we need to understand that blood pressure control does not necessarily have to be only one drug. You may need to be on combination medications, because like this person, I think the person just mentioned only one type of drug. You know, sometimes one drug may not control your BP effectively. You may need to have another class of drug that has a complementary effect to join what you're using currently for a better control.
They say, what is happening to me? I don't smell anything. I hope I'm safe. My name is Yemi from Ijesha.
Well, the problem with not losing your sense of smell, that's called anosmia. You have lost your sense of smell. It means that you need to actually have your nose examined properly, because you need to see the ENT. They need to check because you have some linings in your nose, you know, that makes it sensory, and you have a cranial nerve called the olfactory nerve that helps with your smell. So if anything has damaged, that may be from recurrent allergies or cold or sinusitis or nasal polyps or whatever that is going on in your nasal cavity, can also affect your quality of smell or your sense of smell. And in some people, it has been shown that most people that have lost their sense of smelling may also be low on certain minerals like zinc. They can have zinc deficiency in some cases, because zinc has been known to affect your smell and your taste. So it's very important that you actually go for these checks also and be on these supplements, as they may improve it. So if you are prone to allergies, you're prone to nasal symptoms, you should go and see an ENT doctor, and then you may need to do some zinc supplementation, and you see how that helps.
My sister have low blood pressure. According to her, she said that she was advised to be taking alligator pepper. What's your advice?
I don't know about that. I really don't know about that. I don't know how that works, because I have never used alligator pepper in my practice, and I'm not a traditionalist, so I can't vouch for what I don't have information on. So if she has low blood pressure, I hope it is truly low blood pressure. And if it is, she should go to a hospital and see a doctor, a licensed doctor, to evaluate her.
Okay. I have a regular slight headache that goes on a long time. Doctor said low blood pressure. What can I do?
If you have low blood pressure and it is consistently low, I don't want us to just take one reading and run along with it. It must be persistently like that. And it must be giving you symptoms, you know, like the dizziness, the fatigue, the fainting spells and all that. If that happens to you, you need to treat it as an emergency and go to the hospital. You may need resuscitation, like we said, and you may need to see a cardiologist also to review your case to find out why that is so. You may need to undergo certain investigations that will do a cardiac assessment or a cardiac evaluation for you.
All right. Someone's asking, can I have your number? How can we get to meet
Okay,
you?
so normally we try to respond to most of our audience and patients on via social media, on Instagram and Facebook, on Doctor's Mike. So Doctors Mike on Facebook, Doctors Mike on Instagram. You can drop your comments, your questions, make your inquiries. We'll be glad to help you, respond to you in a timely fashion, and we'll be able to tell you how to reach us if you need to see us in person or you need further help.
Doctors Mike on Facebook. Do you know how to spell doctor, right? DOCTOR. Doctor, DOCTOR apostrophe S. Doctors Mike, MIC. On Facebook and Instagram. All right. And that's not all.
Yes, and we are also big on preventive care. So we want to let everybody know that when it comes to preventive care, we are available for your seminars, your conferences, your wellness checks, your wellness and your wellness screenings, special men's program where we talk to the men or to the women as the case may be. And what we do is that we cater to corporate organizations, estates, schools, offices who require this kind of services. You want to organize a wellness talk or health seminar for your employees, or you want to do an on-site screenings for your employees, we are your very good plug to use. And then we are happy to come there to give you relevant information regarding on health promotion strategies, how to maintain your wellness, and even on basic life-saving skills like first aid trainings, like CPR trainings. We are very big on that because we are tired of hearing of preventable deaths happening in our environment.
All right, that's it. Doctors Mike, we have to go. Everyone, I'm sorry. I'm so sorry, okay? Our time is up. But you know what? We'll do this again. Just, there are several other doctors waiting on that Doctors Mike, Plenty doctors. The surgeons are there.
The surgeons, the gynecologists, the pediatricians, the general physicians, family physicians, ready to help you, ready to give you good counsel and proper guidance on how to follow through on your health journey.
Just go to Doctors Mike and then send a message. Just drop a message there and then you get a response as quickly as possible. Okay? Thank you so much. If I can, okay, for all of these questions, that I couldn't take, we'll touch on it next time. Doc, thank you so much.
Thank you so much for having me.
Thank you indeed. My name is Jude. Ikami Jude. I'll be here tomorrow morning. It will be the Friday edition of the show. I love you all so much. And do have a blessed day. Up next is the news at 12. I'll play you a song by Bob Marley. Good morning to you.